Calls for mental health supports, they have heightened in our country as we are faced with the biggest mental health emergency. And for one group, there's the increase of hate crimes that has also added to the need for supports. CityNews reporter Faiza Amin joins us now talking about this magnified distress. There are programs like the Asian Initiative in mental health, and that has become crucial. Good morning to you.
Good morning, Mel, and that's AIM for short. It's an outpatient mental health clinic, part of UHN, that provides supports to Chinese Canadians, and particularly in Cantonese and Mandarin. They do also provide these supports to other East Asian groups, but they're all about giving access and removing barriers for a population that might not always be able to access these supports. You're about to hear from Dr. Kenneth Fung, who tells me these supports are vital to Chinese Canadians, the biggest minority populations here in Canada. Here's more from Dr. Fung.
They have trouble accessing needed psychiatric help and services. I think of all the medical services, especially in psychiatry, being able to communicate in your own language and having someone who really understands your culture makes a huge difference in diagnosis and care. In fact, we know that as a population, the Chinese Canadians, they tend to seek services much less than other ethnic groups.
Interesting there, Faiza. And if someone doesn't look for help and doesn't get the help that they need right away, I know you've been investigating what that impact looks like.
Yes, Mel, sadly, the situation becomes just more severe. Dr. Fung tells me a lot of times it's because people aren't able to access these supports. He also tells me that compared to other ethnic groups, according to hospital data, Ontario hospital data, I should add, compared to other ethnic groups, Chinese Canadians have the highest rates of involuntary hospitalization. So that's hospitalizations against their will because they're unable to access supports in a timely manner. So he says programs like AIM are crucial for these populations because they remove these barriers. They see thousands of people annually, and the number just continues to grow year over year. We'll have more from Dr. Fung later today on City News at 5 and 6. We'll also tell you about another program, a crucial early intervention program that he says is key. Over to you, Val.